Hello and welcome to the channel. I'm Sarah, and today's guest is Dr. Scott Scher, who's a medical doctor. Dr. Scott and I are going to discuss hyperbaric oxygen therapy as it has a wide range of uses for many different medical conditions and health conditions. It's also very useful for healing, recovery, and it's used by athletes and sports enthusiasts. Dr. Scott describes the physiological mechanisms behind hyperbaric oxygen and the science behind how it works. And most importantly, he's going to describe who shouldn't use hyperbaric oxygen initially and why. Dr. Scott emphasizes an integrative and holistic approach to health, and he describes how to prepare for hyperbaric oxygen therapy using metabolomics, appropriate supplementation. And he also describes how hyperbaric oxygen can be used in conjunction with other therapies, for example, a ketogenic diet, cold thermogenesis, and others. So I'm really excited to talk to Scott because he's an absolute wealth of knowledge. So I'll hand you over now. Welcome to the channel, Scott. Do you want to introduce yourself and let everybody know about your background and what we're going to be talking about today and how you got into hyperbaric oxygen?
Sure. Thank you for having me, Sarah. So my name is Dr. Scott Scher. I'm an internal medicine physician based here in Denver, just outside of actually Boulder, Colorado. I've been in practice for almost 2 decades now, all things said and done. I grew up, though, very alternatively as the son of a chiropractor who's still practicing in New York, where I grew up, and he's in still practice for 45 years now. And so very much came at medicine from a very alternative perspective. Went to medical school with the idea of trying to bring a bridge between allopathic and alternative medicine. There was no such thing as functional medicine or integrative medicine when I went to medical school. And I really my goal was to find a way to bridge that. Of course, I got very interested in what I could make a lot of money doing initially after going through medical school and say, hey, I could be a dermatologist or a gastroenterologist or a radiologist and make a shit ton of money. But in the end, I always kind of came back to really what I wanted to do was find a new path for me to really create something different. And when I was in medical school, in my third year of medical school, I rotated in a place called shock trauma at the University of Maryland in Baltimore, where I trained. And this is in Maryland for those that don't know. In Baltimore, Maryland, Baltimore is very well known for its shock and trauma, especially at that time. It doesn't have a very good reputation for being the safest of cities. Although I kind of got it in a nice little window where it was actually pretty good, but now it's not as good as it was anymore, unfortunately. But so shock trauma is a place where you see a lot of shock, a lot of trauma. Military from all the branches of the United States and actually other countries come there to train on gunshot wounds and things like that. And I was in this rotation for about 3 weeks, and you're on call for 30 hours every 3 days. So that's really good for your circadian rhythm, Sarah, right? And everything else. This is when I was 24, 25. So you can tolerate a lot of things when you're 24, 25, but certainly things like that I couldn't tolerate now. But in that particular experience, I got to see what hyperbaric therapy was all about. There's a large hyperbaric chamber in the basement that they were using for really severe infections, for wounds, for trauma. And I was pretty impressed, even though I was extremely tired during that rotation, that this had this fantastic capacity to heal people in the way it was doing. And after I got some sleep, that rotation was over, started doing some research on hyperbaric medicine. I realized that there was a lot that was happening around the world that was very exciting on the research side, and just the potential to heal and help so many people that were not really being able to help. We really couldn't help in the conventional world at all. And so after I finished my internal medicine residency, I created a hyperbaric practice. And this initially started as medical director of a number of facilities over the years in Northern California, where I was living at the time. And eventually it sort of dovetailed into having more of a consulting practice where I would see people online, virtually, all over the world, both individuals and clinics that were looking to use hyperbaric therapy either personally or with their family members, get chambers for their homes, or in clinics as well. Either the clinic itself looking to use hyperbaric therapy and integrate it into what they were doing. And then when biohacking and those kinds of clinics started coming around, I started to be doing more consulting there as well. And but it was over now 12 or 13 years now that I've been doing hyperbaric medicine. And what I really noticed over the years, especially in the beginning, but really didn't understand it as much in the beginning as I do now, is that hyperbaric medicine is great, but you have to have an integrative context to really see it and the power of it over the long term, not just maybe a short-term gain and then symptoms return kind of thing. And that's one of the one of the complaints in hyperbaric medicine. The people kind of go and they feel better for a little while, and then the symptoms come back, and there's actually reasons for that. And so hyperbaric medicine is my specialty, and that sort of foundationally under that, I really have an integrative, it's called health optimization medicine practice, where I do foundational testing, biomarkers, lifestyle, diet, things like that, to kind of really fully support people, whether they're doing hyperbaric therapy or not.
Well, that's great. So, what kind of patients or people do you see? What kind of situations or conditions can hyperbaric therapy help?
I mean, I see everything across the board, and it could be anybody from an elite athlete that is looking to get that 1 or 2% extra on the field to somebody that has cancer and has stage 4 metastatic disease and needs help there. And I think that the reason is that hyperbaric therapy, the physiology, the mechanisms of action are relatively universal throughout all of the requirements we need to heal, no matter if it's healing from, small sort of things or optimized even at that sort of level on the sort of that spectrum, and then even on the other side of things with severe infection, severe metastatic disease, and there's potential there as well. And the physiology is really what it comes down to. And we can go through, if you're interested, Sarah, like what hyperbaric therapy is and how I kind of frame it, because I think that's typically a good place to start a conversation and then kind of go from there.
Definitely, because just so that people who don't know you, you're very knowledgeable in a very wide field of different practices, whether it's
Hmm.
biochemistry or
Yes.
diet, gut, or all sorts of things. So maybe if you describe hyperbaric therapy as if you were telling it to my mother, and then maybe go into more detail, because there's people who like to know the more molecular side of it.
Sure. I think we can start off with the high level and then we can kind of dive down a little bit deeper. No pun, actually, completely a pun intended there, because we call hyperbaric treatments dives. And we do that because hyperbaric therapy was developed as a treatment for the bends, which is decompression illness. And this is because back in the United States, when they were building bridges, especially the Brooklyn Bridge in the 1880s, 1890s, they would have to sink people under the ground to dig out the bottom of the areas where the bridge was going to go. And so they were sunk underwater. So they were basically in hyperbaric chambers, which we'll talk about what that means in a minute. And what would happen if they came out of these chambers too fast is that a lot of them would get these severe neurologic symptoms, and a lot of them would be like sort of bent over kind of thing. And this is because they would get the bends, or these sort of, what would happen is that nitrogen would come out of the system of the body and start bubbling out and causing blockages and ischemic episodes and things like that. So they realized that people, and we'll get to that physiology in a minute, but they realized if this particular person didn't die when they got out of this chamber that was sunk underneath the water and they went back into work the next day, their symptoms would resolve. And so they realized there's something about being in pressure and going back under pressure that was significantly powerful. And so with that in mind, just to give you a definition of hyperbaric therapy, it's relatively straightforward. It's a combination of increased inspired oxygen with increased atmospheric pressure. I was mentioning pressure just there with the bridges, but let's get back to that in a minute. Let's start with oxygen. Okay. Oxygen is kind of a big deal. All right. We need oxygen to help make ATP, which is our energy currency. If we don't have oxygen around for a very relatively short period of time, most of us know that we do not do well with this, right? Our body needs the oxygen so we can continue to make energy. And so typically in the air that you breathe, you have 21% oxygen. That's at sea level. Where I live here in Colorado, it's about 16 or 17%. If you're on an airplane, about 16 or 15%, somewhere around there, because an airplane's pressurized to 8,000 feet. So good news if you live in Colorado like I do, your jet lag is much better when you fly anywhere because you're flying down to sea level and you're already used to the altitude. That's kind of a side story. And so oxygen is kind of a big deal, okay? And so we have 21% oxygen in the air, and it's carried on, at least at sea level, and it's carried on our red blood cells. Red blood cells are the cells that are specialized in our body to carry oxygen. They have a molecule on them called hemoglobin. They have 250 million of these molecules on there. Each of these molecules can carry four oxygen, excuse me, meaning that each red blood cell can carry 1 billion oxygen molecules. And so for the most part, most of us do really well with that amount of oxygen being carried. If you've ever put a pulse ox on your finger, pulse oximeter, it measures your oxygen level. Typically, it's anywhere between 97 to 100% if you have normal lungs. Now, that's measuring is actually how many sites are bound to the hemoglobin molecules on the red blood cells. And so the question is, well, how do you increase your oxygen carrying capacity if actually what happens is once you breathe in oxygen at 21%, most of those sites are already been bound, right? Because you have 97 to 100%. So you can do a couple of things. The first thing you can do is increase the number of red blood cells in circulation. And red blood cells, if you have more of them, are going to carry more oxygen, right? And so if you come and train with me or near me, not with me because I'm not an ultra marathoner or something like that, but if you come train in Colorado at 5,000, 7,000 feet, what your body does is release a hormone called epogen. And EPO is a hormone that released from your kidneys that increases the number of red blood cells in circulation. So I here living in Colorado have more of them than the average person at sea level. And so that's when I go down to sea level, I feel freaking glorious. And that's why people will train up here, train high, and race low or whatever it's called. That's why they do it. And what you can also do is take this hormone, EPO, as a drug exogenously. And that's what EPO or doping is. And so many people know Lance Armstrong stories and other cyclists that took EPO surreptitiously, so under the table and getting away with it for many years. And that's one of the reasons why they were performing better, because they had more red blood cells. You could also give yourself a red blood cell transfusion, and that's another way to increase your red blood cell number, but you have to be careful here because you have too many, you're actually going to start mucking up the system, causing a lot of increased viscosity in the bloodstream. You can give yourself strokes and heart attacks and things like that. So there's a sort of limit here that you have to be careful of. Okay, so just take a step back and just to kind of rewind here. 21% oxygen in the air. Most of our red blood cells are already carrying oxygen at the 21%. So how can you increase the amount of oxygen in circulation? So the other way you do it is actually you can increase the amount of oxygen in the plasma or the liquid of your bloodstream. The liquid of your bloodstream has very, very little oxygen in it at sea level or at baseline, but we can actually drive about 1,200% or 12 times more oxygen in circulation by using the plasma as our vehicle. But you can't just do that at sea level. You have to do this with pressure. And this is where the atmospheric pressure comes along. So in a chamber, we simulate the pressure you'd feel under a certain amount of seawater. A chamber could be pressurized to 10 feet, 20 feet, 30 feet, or 2 meters, 3 meters, 10 meters, 20 meters, whatever. And every time you go deeper, the more pressure you're under, the more pressure that you combine with the oxygen to drive more oxygen in circulation. So you can think of being underwater, right? Being underwater feels weightless, but if you look above you and let's say you're 10 meters under the sea or in a pool, that's a lot of water above you, and that's extremely heavy. If you pick up a bucket of water, you know that it's heavy. And so we're simulating that pressure you feel under a certain amount of seawater in a hyperbaric chamber. And so it's that combination of increased inspired oxygen with increased atmospheric pressure that drives more oxygen in circulation into that plasma or the liquid of the bloodstream. And again, 1,200%, even more than that's possible. And then what happens after that is you have a whole cascade of physiologic effects that are happening as a result of all that oxygen going in. And there are acute physiological changes, and there are more long-term physiologic changes that are based on how the DNA is being expressed because of the oxygen exposure. So that's the short story, kind of how hyperbaric therapy works and what happens. And then the physiology and the shifts are based on all that oxygen coming in circulation and what that's going to do. And I'm happy to go through that if you'd like, or we can go more in detail through the definition again, if you'd like, for the other listeners out there too.
I think that was a really lovely description. So what would people feel when they're in the chamber? Because when you mentioned diving, when I go swimming and go down really low, I can feel my ears really under pressure. So what would people feel in the chamber? And then what do they usually report feeling when they come out? Because later we're going to go into why this isn't suitable for everybody, but also you have ways to prepare very unwell people for being able to use a chamber, just so that people don't rush out and get one straight away.
Sure.
Well, they can if they want, but what would it feel like being in there and then coming out and it had worked?
Yeah, so it's all based on physics here. So when you pressurize a chamber, you're going to have an air pressure change in your ears. And so you're going to have the same thing you would feel if you were diving several feet or several meters underneath the sea. You would have that same pressurization in your ears that you feel in a hyperbaric chamber as well. Just like being on a plane or a train, it's that kind of thing. It's typically very well tolerated. And what's nice about it is it's being very structured, right? So you have somebody outside a chamber, or you're working on the chamber yourself, depending on the type of chamber you have. And you can slowly increase the pressure. If you're having any issues, you can stop the pressure. You can go back and you can decompress your ears and then go and keep going deeper, that kind of thing. So the main thing you feel is the pressure in your ears, and you will feel temperature changes as well, because pressure and temperature are inversely related. And so you'll have and that's the physics aspect of it. And the other physics aspect that some people like is something called Henry's law. And that's what I was describing before, which is the more pressure you put on a gas, the more of that gas is going to go from a gaseous form to a liquid form. And so in this case, we're talking about oxygen. And so the experience is relatively comfortable for most people. Most people don't have an issue. I would say that about 95% of people can get through hyperbaric therapy without much of an issue. And then about 5% might have some issues with their ears, typically. And that's if they've had issues maybe when they were a kid, or they have some scarring, or they have a lot of wax in their ears. And so wax can just make it difficult to pressurize between the outside and the inside of the middle ear. So the danger there is if you're not able to pressurize or depressurize your ears, you can get eardrum damage or even an eardrum rupture. But again, that's very, very rare if it's done in the right setting, with sort of the right ecosystem overall. But that's the experience itself, and I think that it's really relatively comfortable for most people.
No, that's really interesting, because when I go swimming underwater for a long time, I thought, oh, it's because I'm doing breathing differently. That's why I'm feeling better and enjoying this so much, and because it's cold. But then when I started to follow your work, the more I do underwater swimming, the better I get. I thought, oh my goodness, of course, it's sort of it's the pressure as well, and that's how I got interested in you and your work. Just to backtrack a bit for people who may have never heard of this before, or might have heard the word, what's the level of research in the literature on hyperbaric oxygen like? Because I'm pretty sure there's a reasonably large amount of studies on it.
Yeah, I mean, it's been around a long time. I think the interesting about hyperbaric itself is that the technology has been around in various ways since the 1660s. Yes, 1660. What would happen is that they realized that they could seal a room with steel, like a steel chamber, and they would put a bellow, an organ bellow, on the steel chamber, and either suck air out of the chamber or flood the chamber with more air. They realized at that point that they would actually have different physiologic changes in people. And so, but it wasn't really until the early 1900s and 1920s where the medical side of hyperbaric therapy came around, but that's over 100 years now. And so we have a lot of studies that have show the very powerful effects on the bends, decompression illness, and a lot of studies in the literature on wounds and healing, everything from carbon monoxide poisoning to burns and to traumatic like limb amputations and even like things like really bad spider bites and crazy traumatic things. And then much more research over the last several decades has come out more from let's call it a human optimization perspective, looking at other things that are maybe not as severe, but things like stroke and traumatic brain injury and dementia and chronic infections, surgical recovery from injury just in general, even some studies on longevity and performance, and health optimization and things like that. So the research is very robust on one level, but on the other level, there's a lot of naysayers around hyperbaric therapy because it's difficult to do what we call, quote unquote, good studies in conventional medicine, because the placebo group is always the challenge if you're not giving them hyperbaric therapy, or how you're giving them hyperbaric therapy and how that's comparing to those that are actually getting treatment in the chamber. So that's been worked out over the years in various ways, but it's expensive. It's expensive timing. Typically, hyperbaric chamber protocols are not just a couple treatments. If it's an acute issue, it might be, but if more for a chronic issue, it's going to be multiple, maybe 20, 30, 40 hyperbaric sessions. And that's because how hyperbaric therapy works, right? Because when you're flooding the body with all that oxygen, what happens is the body creates a response to that oxygen in various ways. That oxygen helps you make energy, ATP, sure, but a lot of that oxygen actually is just causing what we call reactive oxygen stress, or reactive oxygen species, causing actually free radical formation. And that free radical formation, what that does is it stimulates stem cells to be released from your bone marrow. So you get exponential releases of stem cells. It also starts stimulating your DNA to start epigenetically changing. So changing expression to help you actually create more inflammatory downregulation over time, actually. It actually decreases inflammation immediately as well. There's also new blood vessels that are getting released as a result of this inflammatory, this oxidative stress that's happening. And then so immediately when you go in the chamber, you get decreased inflammation, you get decreased swelling, you get oxygen delivery, you get immune system activation, you get lymphatic optimization. So your lymphatics are working better, and your overall just as a result of that, you can see fantastic benefits. But long term, like with hyperbaric therapy, more of like for a chronic issue or of a protocol, not only you get decreased inflammation and swelling in the short term, you actually get a downregulation of the inflammatory markers that are causing chronic inflammation in many people. Things like your interleukins and your TNF alphas, for those who know about those kinds of things. And they also the blood vessel growth, as I mentioned, you have angiogenesis, so new blood vessels that are growing in areas that have been injured over time. You have stem cells that are released and now maturing into the types of cells that are required, whether it be bone, brain, cartilage. Like there's been studies in all of these things where hyperbaric therapy can help create all of those kinds of things. And then there's also immune system optimization as well that you see over time as well with hyperbaric therapy, and mitochondrial biogenesis is another one. So new mitochondria as well. So it's important to kind of always remember when you're thinking about hyperbaric therapy about the physiology, because if you think about, okay, I'm flooding the body with more oxygen, and then as a result, all these things are happening. Well, how is it going to help this individual, right? Is it going to decrease inflammation? Is it going to help with blood vessel growth? Is it help with mitochondrial biogenesis? All this sounds great, and it's actually pretty universal, as you can imagine. But not everybody's ready for this kind of exposure, and not everybody's ready for, especially the deeper the pressure, the more oxygen you're going to get, and the more oxidative stress you're going to create. So, for example, if you're at 3 atmospheres of pressure in a chamber, which is the equivalent of 66 feet of seawater, which I think is like 20 meters, I think, you can last there, if you're breathing 100% oxygen, for about 15 to 20 minutes before you have a seizure, typically. And so this is because you're getting such oxidative stress in the brain at that level, 100% oxygen in the chamber, or that you're breathing at 3 ATA, that your brain actually creates so much free radical that you cause a seizure at that time. So there's actually been some interesting studies where you can actually prolong the time to seizure if you have somebody on a ketogenic diet or have ketones on board, for example, interestingly enough. And so that's another way you can protect the brain. And there's lots of ways that I do this. But in my clinical practice, Sarah, what I always try to delineate is it an acute issue or is it a chronic issue? That's kind of my first fork in the road. If it's an acute issue, then I know that hyperbaric therapy is likely going to help them. It's just a matter of how much time, how much pressure for the chamber sessions, and then for how many kind of thing. And then also thinking about a strategy where I call it educationally throwing shit at the wall, which is the sense of understanding what's going to be most supportive for that person at the time as they're going in and trying to heal fast from an injury or something that's more acute, like an acute stroke or a traumatic brain injury or like acute trauma or something, as opposed to somebody with more of a chronic issue that say have like a long-term health issue. Maybe they have mild cognitive impairment. This is not something that happened overnight. This is happening more, cellularly and more foundationally for many, many years. If you just use hyperbaric therapy in these people right away, you may not see the benefits for many reasons, right? Because we're flooding the body with more oxygen. And if the body is flooding with oxygen, you're creating more reactive oxygen species. Do you have the capacity to be able to actually, first of all, harness all that oxygen to make energy? Do you have the machinery in your Krebs cycle? Do you have the machinery in your capacity to take electrons off your food and bring them into your mitochondria? Are your mitochondria working well enough, which is the part of your cell that make energy, to actually create an electron flow with all the complexes on there to actually make energy effectively? And on the other side of things, are you able to take that reactive oxygen species that happen because of energy production and have a balanced antioxidant response to that? It takes at least 3 days to be able to do that, actually. And there's been some studies that shown this, but many people that I work with over the years with chronic complex medical things, sick for long periods of time, they're significantly antioxidant deficient. They have significant mitochondrial stress. And so if I use a hyperbaric therapy on them, they will not feel good. And it's not even just for a couple of days they won't feel good. They won't feel good from the majority of a hyperbaric experience. And then so over the years, I really figured that the timing of going in the chamber is extremely important. And it's not always right for somebody to go in right now. And then understanding that the pressure is also a big component of this, as I was kind of alluding to, because the pressure is really a big deal too, because the more pressure, the more stress. And so these are things that are really important as you're kind of considering as to when hyperbaric therapy might be helpful, because what I often say is that it's not if hyperbaric therapy will be helpful, it is when. And the when is the big deal here, typically.
Yeah, that's really interesting because I think you're the expert in this field. But also I was thinking earlier before this podcast, because I know that the ketogenic diet's very compatible with hyperbaric, and so is cold thermogenesis. And then with the oxygen, I think it would, in a simple language, you describing it triggers a hormetic effect. And then certain people would say inflammation can be helpful, like
Of course.
Dr. Alistair Nunn, and it opens up something called phase space. and then it allows the body to explore different options to begin to heal itself. I know
For
that
sure.
sounded extremely holistic, but you actually went through all of the actual biochemical mechanisms of how that would actually happen. And then, of course, the oxygen would be the terminal electron acceptor for making water, which also is something really important for the mitochondria. So a lot of this really excited me. And then sometimes how something actually works is the opposite to what you think, because too much oxygen is poisonous, as we know. And I think you nailed it importantly, that this therapy is accessible to everybody, but it's not right now. What would you say were the groups of people who listen to what we're talking about, like me, and think, okay, next time I see a hyperbaric chamber, I'm going to go in? Who are those people? And then we can come to the next group of who mustn't go and do it yet. And then you can go through what you'd suggest from clinical practice they can do to get ready to use one.
Yeah. Well, I often ask people, of course, what their goals are with hyperbaric therapy, right? And why they would be thinking about using the chamber. So we talk about decreasing inflammation, mitochondrial biogenesis, talk about more blood vessels, all the things that I mentioned. That says, well, I want all of that, right? That's what somebody might say, and I can appreciate that. But the question is, are you in the financial place to purchase a chamber? Are you in the financial place to actually go to a facility and do hyperbaric therapy? Because both of them are not inexpensive. Purchasing a chamber is going to cost anywhere between, at the lowest, maybe 12 or 13K US, and then at the highest to be 120,000 US. And I think, and so
Before you
there's a
move
cost.
on, what's the difference between a 13K and a 100K
Yeah,
machine?
I was going to go
Sorry.
there too. And that's important. It's important. And so I can address that now. So what I was really kind of alluding to here is that there's a spectrum of pressure that we use in a hyperbaric chamber. That we have mild hyperbaric therapy, and we have what we call medical grade hyperbaric therapy. Mild is typically defined as something usually less than about 15 to 20 feet of seawater. When it comes down to it, they're usually soft chambers, so they're made of a soft material. They don't have to be because they're pressurized to a milder pressure. They're not as hermetically active, to use your word, which I do use as well, as a deeper pressure would be. But also having to remember that the brain and the central nervous system in general is more sensitive to oxygen and pressure than the rest of the body. And so for brain related protocols, the typical protocol range that I use is somewhere between 1.3 and 1.8 atmospheres. And that's the equivalent of about 12 to 13 feet of seawater to about 20 feet of seawater. Actually, a little bit more than that. Maybe like, what's that? It's about 25 feet of seawater, about 1.8. And so again, this is all related to pressure, related to how much pressure you're under, and that's going to cause more oxygen to be driven into the system, as we talked about, into that liquid of the plasma, causing more oxidative stress or hormetic stress or reductive stress or whatever you want to call it. But there's a lot of different words for the same thing. And so when it comes down to it is that if your goals are more brain related, you'd have a milder pressure protocol like that. But if you had more of a like a deeper pressure protocol that you needed, like then you'd be talking about like 1.8 to 2.4 atmospheres, and that's about 25 feet to about 45 feet of seawater. And that's typically in a more medical grade chamber. They're usually hard chambers, either made of aluminum or they're made of some sort of like hard plexiglass material along with metal. And these are things that you'll find in some people's homes now, actually, but mostly you'll find them in medical clinics or in wellness clinics all around the world. There's tons in the UK. There's tons, obviously, in the United States. And so for me, it's like, for the most part, if somebody says to me, if you said to me, Sarah, just in general, hey, Dr. Scott, I want to go in a hyperbaric chamber, I would go, well, why do you want to go in the chamber? Like, what are your goals? And then the second question I would ask you is, from there is like, is it a short-term goal? Do you have like a test next week, or do you have are you having like an injury that you need to recover from? Then let's just get you in immediately so that we can get you a protocol. And then if you're well optimized, great, not much you need to do. If you're not well optimized, then there's more I can do, hopefully to try to help you and support you through hyperbaric experience. So, but I work mostly with people that have more like long-term goals. Like, hey, I want to live a long time, or I want to be healthy as long as I can. And so that's the main category of people that I would typically see. And in that category, what I'd often say is, well, what else are you doing for your health first, right? It's not like the first thing you want to do is go into hyperbaric chamber at all. Maybe and what I often say in the world of complex medical illness, if you've been sick for a long time and you're really not doing well, you certainly don't want to think about hyperbaric therapy as your first option. It's probably your sixth or seventh. Like I typically say, you want to be 60 or 70% better before you'd even think about using hyperbaric therapy to get you the rest of the way there. And it can do that. I've seen it, countless times. But if you start it too early in people that are quite sick, they just can't handle the oxidative stress of being in the chamber unless they're really well supported. And even then, even if they're really well supported, and I can talk about what that means, I still see long term, they don't have as much of a benefit. They tend to have recurrence of symptoms over time because they weren't more foundationally optimized. And so, in a perfect world, what I really recommend people think about is that if you're in that case, if you're in chronic complex medical and you haven't gotten that 60 or 70% better.
When you talk about chronically ill, what are you referring to? Do you mean fibromyalgia, chronic fatigue, multiple rounds of cancer survival, very elderly with neurodegeneration? Because they're sort of different. Or do you mean, say, something like a burnout, multiple autoimmune diseases, or what kind of category would people come in for the chronically not very well? That the group of people who, if they are this, not to rush out now and jump in a chamber, because we were having a conversation before about being energetically aligned, and that's what I like about you so much, is that you don't just say, oh, hyperbaric oxygen chamber saves everything, you all must get in my chamber. It's like, well, actually, you lot can go in now, being sensible, but you lot, I've got another set of things I'd like you to do first of all to make sure that it's safe, because otherwise people are just hurting themselves and spending money for no reason, and then they get put off hyperbaric oxygen therapy when it could have helped them, say, in a year and a half or 2 years.
Yeah, it's well said, and I think your question is a good one, and it's a spectrum, right? There are some people that are relatively well optimized, and maybe they have a little bit of burnout and they're okay, and then they don't have to do a whole lot before they go into the chamber. And there's other people that have been chronically sick for many, many years that can't get out of bed without chronic fatigue and they only have like an hour every day that they feel good, right? What I think my high level way of approaching this is to be pretty standard for almost everybody that I work with, is that if you haven't had a foundational assessment of your biology, what I call metabolomic testing was what I use in clinical practice, which is looking at the results of your genetic predispositions, but all the levels after that. So your genes, your transcriptome, your proteome, and your metabolome. That's all part of like how your DNA transcribes proteins and all the steps afterwards. But also looking at environmental exposures, and at the same time looking at toxins in the environment, food, water, environment, microbiota, things like that. You can look at all on what's called the metabolomic level. So I do that in clinical practice.
Do you want to describe metabolomics for a bit? Because I know what it is, and some people don't, and it's something that I also, being a scientist, I am very open to things, but also sometimes it's better to test. So, or actually, no, it's all the time. You need data and you need sort of tangible variables, like you said, a goal. What is metabolomics? Because sometimes people get overwhelmed with so many tests that they've spent all their money on tests and then they haven't got any left to do the HBO.
Yeah, it's a good point. I mean, with metabolomics, the nice thing about this particular science is it's been around for almost 3 decades now, and it's not really something that's used in conventional practice, but there's getting more interest in the outside of conventional practice, and it's been called the stethoscope of the 21st century, even a decade ago, and just because of how powerful it can be. Because you look at data and networks of data from a cellular perspective, you can see what's happening right now in the cells and just what happened recently as well from various types of biochemical reactions, and you can see what's happening. In my world, what I got so interested was that I could understand what was happening from a mitochondrial perspective, how well they were able to take energy from their food and create the intermediates that are responsible for flipping off electrons from your food in your citric acid cycle in your mitochondria, and then understand how well that energy is being produced, and then also what the detox pathways look afterwards. And so for me, using that perspective, transformed my clinical practice, because as soon as I understood that you can start optimizing somebody from a cellular perspective, give them 3 or 6 months to try to get their act cellularly in order, and then use hyperbaric therapy, I would just see transformative differences in patients. It wasn't like, it's not subtle. And the reason for that is they would already be doing so much better even before they got into the chamber. And I could think of like a number of people, like even somebody with a traumatic brain injury, for example, that had a TBI for, traumatic brain injury for maybe 3 years or something like that at the point when they saw me. And they just were not doing well. They really wanted to get into a chamber to feel better. I'm like, hey, look, let's do some testing. Let's see kind of where you are. Like, can you actually use and utilize all this oxygen that we're about to give you to do all the things that we wanted to do to help you, actually heal your brain. And he listened to me, and we did 3 months of testing. We did 3 months of optimizing on the cellular level. And of course, it wasn't just supplementation, but that was part of it, but also trying to change his diet, get him better sunlight and do all the things on the stress level that's, I find, is just kind of pervasive to a lot of everybody these days. Is just if you're in sympathetic mode all the time, if you're in fight or flight all the time, you're not going to heal. And I found that that's been a big lever for me to pull over the last a while now, at least the last 2 or 3 years. It's been much more on my radar, where if somebody's really stressed and they think they're going to get better, they're not, typically, if their stress isn't addressed first, because the body can't heal in stress mode. It's just not possible. It only heals when you're in parasympathetic. And I guess a quick side story about that is I gave myself a mild concussion maybe 4 or 5 years ago, longer than that now. And I was pretty well optimized. I was an acute issue, and I was like, let's get in the chamber. And I was in the chamber, and so in the chamber that I was in, it was pressurized with 100% oxygen. So you can't bring anything inside those chambers. But outside of it, there was a TV, and there was sound coming in. And I was watching John Wick 2 or something, which is like a ridiculously violent movie. And I was like in the chamber, like shaking like this. I'm like, this is not any way I'm going to heal, is it? Right. And so, because my body was just sort of in stress mode. And so it's a big thing that I think about as I'm optimizing people. And I can see this metabolomically when I look at some of their testing and look at oxidative stress levels, which is like how many antioxidants, or what your antioxidant capacity in the body is. You can look at your gut. You can look at gut metabolites as well and get a sense of somebody's gut integrity. And that's could be a big deal, because if you have a leaky gut, you have a leaky brain, which means that your blood-brain barrier is not keeping things out. And so I guess, high level here, to not get too much in the weeds, is that the metabolomic testing is a great way to look at sort of a benchmark for your patients, in my patients, how well they're doing cellularly and how well they're going to tolerate going into a chamber. And this is not always necessary. And I 100% agree with this, right? In the sense that if you're pretty well optimized, you're healthy, you don't have any energy issues, you're not in chronic pain, you don't have chronic medical issues, like, and you're just, a little bit of burnout, like I'm tired, then I think using hyperbaric therapy without this testing, probably okay, right? But you probably don't want to start like at a deeper pressure. You might want to start at a milder pressure first to make sure you're okay. If you have a reaction, like in the sense that you feel terrible at a certain pressure, even if it's mild, you go in, well, that's also, in my world, diagnostic, right? If somebody goes into a chamber for, let's say, like, hey, I'm healthy, I want to go in for a longevity protocol, which for me would be 40 sessions, and we can talk about that too. But they go in at the first session and they go at our longevity protocol pressure, which is 2.0, and they feel like crap. Well, that's pretty obvious to me that, oh, I'm healthy, I do all the right things, I eat my kale smoothies, and I wear sunscreen all the time, right? And so, I try to tease that out, of course, when I talk to people, but that's also indicative for me that there's something more cellularly that's required to really see optimized strategies. And my sort of, I guess, my secret goal, Sarah, on some level, is that the majority of people that I see don't even need to go into a hyperbaric chamber, right? If they can optimize cellularly, from the foundational perspective, they can use hyperbaric therapy if they want to, but they don't need to, or they can use it more periodically for just sort of health and wellness, recovery, optimization, endurance kinds of strategies. So, but it's a big part of my clinical practice, but I'm honestly doing that, and probably, in the people that I work with, because I would do a lot of remote consulting, probably maybe 20 or 30% of those people are actually doing this kind of extensive testing. So if you're relatively well optimized, you probably don't need to, but you have to be really careful with your pressure, and see how you feel. But if you're sicker, I really do implore you, and I do recommend everybody that I speak to that is on that sicker level, or chronically has an issue, that they do some of this testing and really consider that as part of their workup before getting into a chamber.
Oh no, that's really interesting because yeah, testing. First of all, it's to see well what happened after I went in the chamber. But someone might tell you, "Oh, I'm okay," but they're just fibbing because they want to get in the machine,
Hmm.
and then they'll turn around and say, "Oh yeah, you broke me or whatever." Then the other thing we were discussing supplements before. What happens when you get people who come to you who are already on loads of supplements because we can just buy supplements whenever we want, and I've got that's in my old age, I've got really pissed off about stuff with people. I always say, don't take something you don't understand how it
Sure,
works.
sure.
And then because you can't buy a hyperbaric oxygen chamber and certain other things, what do you do when people are already on, say, glutathione and B vitamins and already on loads of supplements and they still feel crap? And then like, you did cover the thing about the smoothies, and oh yes, that's also the issue. So what would you do there? Because I get people who say, "Oh, I've tried everything," and then like yourself, in my head, when I go through all the questions, I'll think, "Oh, you've tried probably 10% of the possibilities." So
Right,
what
right.
would you do for somebody who comes with you that's in a not a good state, say biochemically, but's already taking a lot of supplements?
Yeah, I mean, it's a great question, and it's something that I do see on a relatively frequent basis. Most people are taking supplements that they heard about from some influencer on Instagram. So I think you mentioned making sure you understand why you're taking things, Sarah. I had a talk in 2019 in the UK, actually in London, and I asked everybody in the audience how many people are taking supplements, and this is at a biohacking conference, right? So like 99% of people raise their hands, right? And then, but the second question is the more interesting one, is that how many people are taking supplements that they understand their biology and have tested for what they needed and are taking supplements directed to what they need. About half the room, even three-quarters of the room, actually put their hands down at that time. Now things are a little bit better now because there's more testing available than there was in 2019, even though it doesn't feel like that long ago, but it was a long time ago. And but I'm a big proponent of not guessing what you need and
Mm.
testing what testing, and then using what we call bioidentical and phytoceuticals. But I mean by that is, so things that the bioidenticals are things that the body's seen in evolution for millions of years, at least the primate has, right? And so these are like your B vitamins or your antioxidants
Or
or your
pregnenolone or something like
right,
that.
or pregnenolone, or some of your hormones, exactly right. And then you have your phytoceuticals, which are things that we were around also for millions of years. Things like mushrooms and things like plants, like kava, for example,
And
or
curcumin.
curcumin and ashwagandha and herbs. So these are things that we've seen in evolution for millions of years too. Like the third level here is the things that the body hasn't seen, and these are things like pharmaceuticals or pharmaceutical derived
Or
kinds of things.
peptides.
Peptides are a bit of a mix, right?
Yeah,
Because
they're
peptide
a bit, they're half and
Yeah,
half. Yeah.
because peptides are natural. Like the amino acid sequences are things that our body has seen in evolution. It's just the way they're being administered and getting into the body is the strange way. But peptide sequences are this. Some of them are
Don't they
not.
have things like DAC on them to try and make them not be degraded as quickly in the bloodstream? I mean, I think that we could,
Right.
me and you could
There's
talk for probably like 5 years, but
right,
yeah,
right. Yeah.
but like that's a good point. The peptides sit somewhere in the middle of.
Right, but they have to be, like you said, they have to be preserved in various ways to get them in locations, and so the actual administration is not the same as the actual peptide that you would take because of those other things that you're getting in addition to the peptide, for sure. But yeah, peptides kind of fall in a little bit of a gray sort of like spectrum category within all, like the bioidentical and also the pharmaceutical a little bit too. But in essence, I want people to be taking things that are aligned with their biology, right? And but even that might not be enough for some people, right? And then in the sense that I have a lot of people now that I'm seeing more that fall into this category where they're taking a lot of things that should be working, but they don't. And that is because of what we call in conventional medicine supratentorial problems, things above the neck. And what I mean also by that is it's mostly related to stress. Okay. And so the sympathetic fight or flight, I call this the sympathetic spiral of doom, Sarah, where people are just in this fight or flight all the time and their body is churning out neurotransmitters like norepinephrine, epinephrine, and then also hormones like cortisol that really have a huge effect on the mitochondria, causing them to shift into something called the cell danger response, which is when they get really scared and then they can't make energy really well. And they also put out more stress signals. And then you have more stress, and that sympathetic overdrive continues. And so what I found is that the sympathetic activation is the key to break there. If you can break the sympathetic activation, then you could actually see people start healing. And that's been a big part for my clinical practice over the last several years, is where I realized, like, why aren't people getting, even with, so like in my clinical practice, right, as doing health optimization medicine, what I do a lot of data work, and I try to do lifestyle, try to do diet and and everything else. I still was seeing a certain amount of people that were not getting better. And I realized, I kind of always knew this in the back of my head, is that there's certain people that you talk to as a clinician that you know very quickly if you're going to be able to help them or not. And this is often because of that. What I found, at least me personally in my clinical practice, is if they have this sympathetic activation that needs to be addressed. And so why? Is it relationships? Is it and family issues? Is it job stress? Is it because, unfortunately, we're traumatized, like PTSD, or like had childhood trauma, and that, the body keeps the score. And like you can see this manifest in lots of different ways of like a safety issue for people over the long term. And so I'm in a big proponent of leveraging what's called the GABA system in our brain. And this is actually what ketones do, interestingly enough. But that's one of the reasons why we think ketogenic diets are helpful in mental health issues, actually, amongst the mitochondrial support as well. But the GABA system is extremely important here. The GABA is our primary inhibitory neurotransmitter in the brain. So it's the one that's actually formed from another neurotransmitter called glutamate, and glutamate's our primary excitatory. So they're always supposed to be in balance. But if you're GABA deficient, which many people are because of stress and because of sympathetic activation for long periods of time, you have more anxiety, you have more depression, you have more insomnia, tremors, because the brain is not be able to regulate information as easily, because GABA is the major regulator. And so I really think about that system a lot now, and as a big piece. If I feel like I can see this sort of a mile away when somebody comes to see me at this point in my career. But it's one of the things, if you're listening, right, if you're thinking, well, I'm doing everything right, like I'm doing all the supplements, I'm doing the diet, I'm doing the lifestyle, but I'm not getting better, right? Is hyperbaric therapy going to be the right thing for you? The answer is probably not. Probably there is a stress sympathetic overdrive piece that you're not addressing that is the first or the next step in your evolution. And it may be that thing you didn't think caused an issue 10 or 15 years ago that is now just built up and built up and built up. And I've seen this time and time again. And it's not to say that it's all in your head, but at the same time, it is in your brain and neurochemistry, but it's not like you can just think your way out of it. And I think that's what I like to remember and remind people. It's like, more thinking is not going to solve problems. You already are having 70,000 thoughts every day. Do you think 75,000 is going to make it any better? The answer is no. And in fact, when you're GABA deficient, you're upwards of 120, 140,000 thoughts per day. And so don't believe everything you think, and you're not going to think yourself out of anxiety or out of stress. It's just not going to be possible. I have lots of other strategies to think about otherwise.
Definitely. It's interesting you mentioned this, because the podcast before you that's being uploaded today was all about Amanita muscaria.
Oh, nice.
A science teacher who it saved her from suicide. And she's now one of the world experts on Amanita muscaria. So everybody's had a big lesson already on GABA and glutamate, because you're right. That if people are stuck in their head, just telling them to just get over it or think happy. Right. Sometimes you do need a biochemical intervention, and it's muscimol and ibotenic acid in Amanita muscaria, and it's something people can watch the podcast. But that's super people cool you had her on. So stuck somewhere. You need something to turf them out of that fight or flight. Some people find that breathing or psychedelics or whatever, that can change it for them. And then again, the Amanita muscaria changed this person. She's called Amanita Dreamer, and then she's gone off to have her life and her purpose. But then it's something I was going to ask you about. Say if somebody comes to you and says, "Oh, Scott, I really want to use a hyperbaric, but I don't want to take all these supplements." But they're definitely somebody who needs to take supplements and have their levels of different things raised, whether it's antioxidants or whatever. Could that person use your protocol for doing, say, biological optimization, and then go in the hyperbaric chamber and then get that to give them benefits, and then drop all the supplements once they've got the hyperbaric oxygen going? Because sometimes people get wary. They say, "Oh, I don't want to go and see that person. They're just going to put me on supplements," even if they do need things. So can hyperbaric oxygen, say if somebody's got better, that's the other scenario. They've taken their supplements, done their diet. Could
Sure.
hyperbaric oxygen mean they can then get rid of some of their supplements? Because not everybody wants
Yeah,
to take things because it costs money, and
sure.
even I don't know what a lot of things actually fully do in like the full detail down to the last electron. I want to thank my sponsor, Lightwater Scientific, who helped me deliver free, valuable information to you and also allow me to have great guests on this channel. Lightwater Scientific produce the purest and most deuterium-depleted water in the world. Depleting or lowering your deuterium has numerous health benefits, from better metabolic health, more energy, greater resilience, less brain fog, increased physical performance, enhanced healing, and healthier mitochondria. Deuterium is an isotope of hydrogen, also known as heavy water, because it's bigger and heavier than regular hydrogen. Even though deuterium makes up only 0.02% of hydrogen, it's found everywhere. Deuterium is a burden to your body because it interferes with the intricate chemical reactions that occur by slowing them down. Deuterium is kryptonite to your mitochondria, and we need healthy mitochondria to produce energy. There's over 60 years of scientific research on the negative effects of too much deuterium on health, and also the positive benefits of lowering deuterium in the body. Lightwater deuterium depleted water is 100% safe and non-toxic. In fact, it's the closest in structure to the metabolic water that your mitochondria produce. Lightwater deuterium depleted water comes in 5 or 10 parts per million glass or plastic bottles. So level up your health by leveling down your deuterium today. The purchase link is in the show notes, and use code Dr. Sarah for a discount off your order.
Of course, and nobody does, right? Nobody
Yeah.
knows the detail to the last electron, right? They're moving too fast for us to really know,
Yeah.
and changing all of their directions and places. It's a really good question. What I always say here, Sarah, is that it's a very individual kind of thing, right? Everybody's going to be very, very different from one person to the next as far as what their biochemistry is going to be able to sustain over time. Even doing the best things, because there's genetic aspects of all these things as well. And we do know that, aging is one of those things that all of us are doing right now, right? And so aging is one of the things where our evolutionarily programmed bodies were not supposed to survive after about 40 or 50 years of age for most of us. Yes, we had longevity. Yes, people did live to 100 and 1,000 years ago, probably, but very few did. Most of them died off so that there was room for the new generation. So you have to think of these avatars, these meat suits that we wear, as things that were not supposed to last more than that time frame. So to maintain them over a period of time after you've reached your sort of peak years in procreation and rearing children and growing them up, then you have to be thinking about what else you're going to be doing to really optimize your system to be here as long as you want to be, as healthy as you can. That's the starting point for people, for me, and that's the conversation. And then from there, what are they really aligned with and what are they not aligned with? If they're not aligned with supplements, then we can do various other kinds of things that are more energetic right on the side. You can think about, we can talk about things like hydrogen, for example, which I know you're a fan of, which I do use in hyperbaric practice a decent amount.
Yeah, I do like gases and molecules. Yeah, so I like hydrogen, and then carbon dioxide and nanobubbles. That's the problem. We could go on for ages, because you kind of read my mind. I was just about to ask, how compatible is this with other gases?
Yeah, so there are some people that are using, just to answer your question, I think briefly, is that the goal really with hyperbaric therapy is that you don't need to be on as many things that were supporting you if you heal some of the tissue and heal some of the places that you were having issues before, right? So if you're having brain issues before, you get a hyperbaric protocol, you feel fantastic after 30 or 40 treatments, and your brain's doing great, then you can come down off your supplements. And that's the idea, right? The goal is that you be on as minimum as you need for as long as you can, until you need other stuff for whatever reason. And then you can be on that for as long as you need to, for the minimum as you can. So I always think about it as this: from the evolutionary perspective, most of us are going to need additional support after we get to be 40, 45 years of age or older. It's just what that support is going to be depending on the person and what they're going to be aligned with, right? If they're interested in electricity and gases like you are, then that's where they can go. They can look at things like carbonic anhydrous gas. They can look at hydrogen. They can look at things like deuterium depleted water and things like that. That's totally cool. And like, if that's the journey you want to be on, like it's fine, right? It's hard to quantify those kinds of things, right? It's hard to quantify, but at the same time, if you feel great and you're doing those and you have a sort of a protocol, I use hydrogen gas all the time in clinical practice, actually, because it's a great way to support that redox in the mitochondria, like, and especially on the antioxidant side. So people that are sicker, that have more sort of oxidative stress symptoms, which could be GI distress, it could be headaches, it could be brain fog, it could be irritability. Like, they do really well with hydrogen gas as a way to support their hyperbaric protocol. There is some interest in using carbonic anhydrase, so CO2 gas, with hyperbaric therapy, but this is trickier because of the CO2-O2 balance that's happening when you're combining these two things together. I've used the carbonic anhydrase gas in other realms because it does vasodilate, and I do like vasodilation when it comes to combining it with hyperbarics.
I was going to ask about nitric oxide and then about
Yeah,
ozone. I'll just go through my list. I'll let you
go for it.
carry on because
Yeah,
you're
go
in a
ahead.
flow now.
I can go for ozone and nitric oxide. So talking about carbonic anhydrase, just to finish up on that, CO2 does vasodilate, and so I do think of that vasodilatation can be helpful under hyperbaric exposure, because one thing I didn't mention is that one of the acute things that happens in hyperbaric chambers, especially at deeper pressures, because of the hormetic oxidative load, is that you do have some vasoconstriction that happens. This is not necessarily a bad thing for like an acute trauma, but it could be bad or not as optimal if you're looking for, blood flow optimization. So that vasoconstriction, carbonic anhydrase can do that, the CO2, but more primarily I use nitric oxide for this, because nitric oxide is potentially acutely depleted with hyperbaric therapy in the blood vasculature, causing vasoconstriction. This is because the oxygen itself actually binds to the NO, making it NOO, which means that it's not reactive or not nitric oxide anymore. This is short-lived, but deeper pressures, I will use nitric oxide as a way to support the vasodilation that I think could be helpful, especially at deeper pressures, depending on the indication we're going to the chamber. So. So I think the framework here that might be helpful, Sarah, as I talk about this, would be that when I think about hyperbaric therapy, I think, what are you going to do before? What are you doing during? And what are you doing after hyperbaric therapy to optimize the experience? And before hyperbaric therapy, I'm thinking about optimizing your foundational biology as much as you can, even so not just right before you go in, but actually, the period before, like say 3 months. But initially, or immediately when you go into the chamber, at that point, you want to think about dilating blood vessels potentially and getting more of the machinery that's required to make energy available to your cells. So this could be something like, like a B vitamin or something like that, where you're actually giving the cofactors responsible for getting energy produced in the mitochondria, for example. That depends on the person, and then you also want to be thinking about that dilation. That's why I use nitric oxide. I use CoQ10 for that sometimes as well. And then inside the chamber, like while you're in there, you're obviously in the chamber, you're getting hyperbaric therapy, you're doing your thing, but you actually have more oxygen to your brain. If you have a brain injury or if you have something going on with your brain, like doing actual exercises in there, if you can, it can actually be great to stimulate various parts of your brain to wake up. And because we know oxygen's the sort of limiting factor for healing oftentimes in the brain. And so in post-hyperbaric therapy, I'm thinking of more of like the detox side of things typically. Like, what are you doing to help? You just made all this energy, you just made all these reactive oxygen species. How are you helping with the detoxification side? So hydrogen gas can be used here. That's what I typically use it. I also think about infrared sauna, for example, being another great way to help with detoxification pathways. So that's just a framework that might be helpful.
Yeah, it's really helpful because I'm at the stage where, it's like we're going to have to, I know you're short of time because, you stop something when you really want more to talk to you. Where can people learn? Have you got a book or I think you've got a practice, but I think you said you're quite busy, but you definitely work worldwide. If people
Yes.
want to learn more about you, because you know a lot more than you've managed to condense very concisely into like an hour, where can people find you, and what else are you really interested in?
Sure. Yeah. So I have the sort of the main website I think to find me would be drscottscherr.com. Just my name, DrScottScherr.com. And what I have there is I have a hyperbaric consulting practice where if you're interested in hyperbaric therapy and you want to learn about how it might help you over 30 minutes or an hour, depending on your situation, we can go and we can talk about it and see how hyperbaric therapy might be helpful and what other things might be helpful around this. Because again, I have an integrative practice. I'm not just looking at hyperbaric therapy. We're talking about labs, if possible, as I've been describing here, talking about other technologies that might be helpful, maybe supplementation as well, depending on the person and what they're interested in. Also other practitioners that might be very helpful for you. What kind of referrals can I make for you? And then how we're going to sort of assess your progress over time. So that's what I talk about in any kind of consult on hyperbaric therapy. And then I also have, I also work with clinics that are interested in using hyperbaric therapy in a integrative way, or sometimes as the only modality to start off with. So I work with clinics all over the world and how to integrate hyperbaric therapy with other modalities. So if clinicians are interested, they can also reach out to me on that same website. And I also have my health optimization medicine practice, which is my foundational metabolomic testing, looking at diet, lifestyle, chronobiology, circadian rhythms, and bioenergetics, and do all the light water magnetism stuff too, by the way, in various pieces, right? But I do it depending on the person and kind of where they're at. So that you can find also on my website, and then I also have a couple of companies as well. Did you have a comment before I keep going?
I was just going to say that I light water magnetism. I've moved into like plasma and charge and ether as well, just because
Sweet.
you know
Okay.
sometimes people think it's very easy to think certain people think in a certain way, like we did about each other, and then we actually think in exactly the same way.
Of course, yeah, yeah.
So yeah, I think it's something. What I was getting at is, have you got a book? Because I don't think
I don't. No, I don't have a book.
that's the other thing, because
Yeah.
what you bring is really important, because I think I know you're going to laugh now, but in Maryland, that was where you first got into the hyperbaric oxygen chamber. So you've got actually a huge like it's several decades, isn't it, since you got into it? Is that correct?
Yeah, I mean, it's been now about 12 or 13 years in
Yeah.
hyperbaric medicine directly.
Yeah,
Yeah.
I knew it was either 20 or 10. And so that's like, and there isn't really anybody else who know about just the physics or just the machine, but they don't know any of the biology. And then because you've practiced as a doctor, you have the whole how to deal with the patients, because that's also really important as well. I know I did interrupt you, but also as you were describing all the stuff that you're doing, like the two companies and different businesses, it's obviously you're the product of your own therapy and your own hyperbaric oxygen. So it's obviously you're in good health and in the flow all the time. So as I always say, you must be doing something right.
I try to. I mean,
Or
again,
people say that about me as well, even though like people go and laugh about the stuff that I sometimes get into. It's at the end of the day, we're both still here, like doing things and are healthy
yeah,
and happy
yeah,
and stuff like
yeah,
that. And it was more that to point people at you, just because we've like done a fraction of what you work on,
yeah.
and then
Hmm.
definitely because straight away people ask me, "Oh, was Dr. Scott got a book?" So.
Yeah, it's been in mothballs for a couple of years, but maybe can somebody convince me to finish it? But the framework that I've developed over the years is actually very simple.
Yeah.
And it's really just looking at hyperbaric therapy in an integrative context. And maybe that part I could put into a pamphlet at some point. I've debated about that. But if you're interested in hyperbaric therapy, again, you can consult with me. I also have a company. It's called One Base Health, and it's a company that does some hyperbaric sales and also other technologies. But our real goal is to integrate devices together in various ways so you can actually have more intentional protocols and know what's going on when you're in the chamber or with the other devices, and also know what's going on with your devices in sort of a bidirectional flow. But that's also available. I just want to mention, because we didn't talk about types of chambers, that what we did talk about a little bit, but you can purchase a chamber for your house if that's something you're interested in. But I also think it's important that you kind of understand why you want to be purchasing it, and also thinking if it's the right thing right now to spend the money on. And I also have another company. It's called, it's a nonprofit that's called Home Hope, which is the nonprofit that I was trained in, the framework called Health Optimization Medicine and Practice. You can check it out at homehope.org. And then I have a company that also does a lot of work in the sort of, I think, the cutting edge nutraceutical space, that it's called Transcriptions. It's a company that makes multiple different types of supplements to help people right now along the path to optimizing the health. And some of the ones I was sort of alluding to today were
Are those the Troches?
the troches. Yeah,
Yes,
exactly.
I know what those are. Yes, I always recommend those when people ask me about certain things. Yeah, those
Sweet.
I didn't know it was you.
Yeah, that's my company. It's called Transcriptions. We make a bunch
Yeah,
of things.
there's loads
Um,
now. Yeah.
yeah, we have the ones that I've been so impactful recently have been the ones that sort of leverage the GABA system specifically. And the problem is that if you take a GABA supplement, like GABA itself, and it works for you, it's often because you have a leaky brain. Your brain's not doing
Yeah,
what it's supposed to do. And
because yeah,
so,
yeah. If you just take
yeah,
GABA, isn't it only something like 1 in 10,000 molecules of GABA can actually go
yeah,
across? That's
it's
really
extremely,
interesting. Yes.
Yeah, it's extremely so. But interesting that you were talking about Amanita because we
Yes.
actually have Agarin or Muscimol in one of our products, two of
Oh,
our
really?
products. It's isolated and synthesized, and so it's not from the mushroom directly. But Agarin's a long acting on the GABA receptor itself. It gets across the blood-brain barrier or Muscimol, as it's also called, which are fantastic to enhance the GABA system. So that's cool. The synchronicity about
Also,
yeah,
with those trochees, there's like all kinds of really unusual blends of things. And
Mhm.
I think because Sarah Kleiner told, well, I think she had some in her house, and I was like, oh,
Yeah,
what's this? But ever since that, this is like 2 years ago, there's now a whole big family of them. So yeah,
yes,
people
we do.
definitely, I'm definitely know people know what they mean because we'll link everything in the show notes anyway, so people can check out all of your offerings because you offer lots, and it's like I'm at the stage now. If people I can just help with what I think they're not doing. And yeah, sure, some people love certain modalities, and that's absolutely fantastic if it works for them.
Mhm.
But then, if everything was working, then why have they come to see me or you? That's always the question. It's always what's missing. So I think people can find out about your different offerings. And yeah, that's funny. I didn't realize you were the trochee man.
Yeah, that's us too. Yeah. So, but that's it's a really great delivery. It goes in the mouth and
Yeah.
dissolves and it's fast acting. Yeah. So check it out at my website, drscottshire.com. You can also find me on Instagram at the same name. You can find One Base Health on Instagram. You can find transcriptions there. We're all around. And so I really do appreciate the time, Sarah. Thank you for having me.
No, it's been really good fun talking to you. It's been very like authentic and genuine as well. So that's, I think people will sense that. So yeah, thank you very much. I really enjoyed this, and also I've learnt a lot now as well because I had questions about the hyperbaric, but I think you just packaged it up so nicely, and you didn't try and force anything on anybody, which makes me want to try it even more now.
Yeah, that's a benefit that I have for not owning a hyperbaric clinic, maybe. I don't have to force people or try to get people into chambers. I just try to do what's right. And that's what I do.
Thank you. Thank you very much for watching. I hope you found this useful. You can find the links to Scott's website and his offerings in the description. If you're interested in learning quantum biology, because this is a great gateway into healing, say if you wanted to do something like hyperbaric therapy later, check out my Quantum Starter Kit, which is extremely affordable. Or if you are not ready to buy a course yet, check out my Substack because it has a wealth of information to help you improve yourself. So thank you very much for watching.